Sleep apnea has become a buzzword, so to speak, because just as of recently, there was a famous football player, Reggie White of the Green Bay Packers, that had sleep apnea and wasn't even diagnosed with it or aware of it. He ended up dying of sleep apnea because he just wasn't breathing. He wasn't getting air to his lungs and thereby to his heart. He died. So today, we've become more aware of that through many diagnostic procedures and screening devices we use. Many patients cannot tolerate a CPAP, continuous positive air pressure machine, that they have to have forced air pushed within their lungs. Many people cannot adapt to that, as many as 50%. Dentistry has offered a solution to that to allow forward positioning of the jaw and thereby opening the airway and creating an airway passage for that patient to be able to be sleep comfortable and no apneic events. So in that regard, dentistry has provided a great service to their patients as far as life-threatening conditions and sleep apnea. Sleep apnea can be a very insidious disease. A person can be going throughout their day and dozing off in front of the TV while being parked at a stoplight, just sitting on a park bench and sitting for 5 minutes. These things can go unnoticed because we think it's a common thing. But patients should be aware of that kind of process happening slowly. If they're falling asleep while they're on an interstate or on a throughway, large highway, and they're falling asleep, that's got to be a red flag to them. And they need to be screened through their dentist or their physician to determine whether that's an issue for them. Because unless we identify those risk factors, sleep apnea can become overwhelm the patient and create a life-threatening experience. Today, we have the convenience of having a cone beam CT scan available to expose the airway. So a dentist can identify if a patient is at risk for sleep apnea and then take this field of view in the laryngeal airway stream and thereby identify if a constriction is taking place. The dentist is then able to place for the patient a device which can open the airway, and we can use these biometrics of the cone beam to identify how much opening is thereby created with this appliance, thereby being a wonderful, again, service.